Welcome again to welcome back to our conference, and we are shifting to a panel on COVID-19 and economic policy 1 year after. We have three speakers today, and Andy Atkinson, Christy Romer, and Abby Wozniak, and we'll just turn it over to them. Speakers reminding you that you have 15 minutes, and audience, please raise your hand, or that's the best thing to do, or alternatively Q&A or chat. Okay, Andy.
All right, well, thank you for having me talk today. What I'd like to talk about is kind of what we've learned over the last year about behavior, endogenous, private, and public responses to disease. I want to talk about both how that shapes the dynamics of the epidemic, say relative to what forecasts we made a year ago. But more importantly, I want to talk about how behavior, the endogenous response, and I'll say both public and private, because we're seeing, state and local governments responding what appears with endogenously to the disease. How that constrains our options for mitigating the health impacts of pandemics unless we can come up with a technological solution like a vaccine or a cure. And I want to organize my talk around just showing you 6 simulations from a model that I think fits the data on deaths for the US fairly well over the past year. And a key feature of the model is that it incorporates a prevalence-elastic demand for costly measures for disease control. So that's a phrase that Thomas Phillipson used to describe what he saw as the endogenous behavioral response to the HIV/AIDS epidemic. But the basic idea is, what we see is that both individual and public mitigation efforts rise and fall as current levels of infections and deaths rise and fall. And that aspect of the behavioral response means that behavior has a very different impact on how the pandemic evolves in the short term versus the long term. And it also means that it puts constraints on what we can achieve with additional public health interventions like testing and tracing, or federal programs, unless we make those programs permanent or we come up with a vaccine or a cure. And so I want to talk about those two aspects of behavior and the dynamics of epidemics, and then finish with a simulation as to why getting better at non-pharmaceutical interventions should be a high priority even now, when it looks like we have a lot of good news about the epidemic, because there's a scenario that's not so good if immunity is not permanent or long-lasting. So the first simulation I want to show you from the model is basically, if I take the model and turn off the responsive behavior to the epidemic, and just run the disease through the population in the way that a standard epidemiological model would do. And the parameters of this model are chosen so that it's pretty much in line with the types of forecasts you saw out of the university, I should say Imperial College London, or what Angela Merkel said, back in March of 2020, that a large majority of Germans were going to experience the disease. So the model forecast, or actually the model simulation, is in blue, and data on the 7-day moving average of daily deaths in the United States from the CDC are in red. And so I want you to see 2 things in here. First is the model predicts just a catastrophic first peak. This peak here has daily deaths over 30,000 a day. And then the epidemic, through herd immunity, just ends quite quickly. It should have been over basically by now. But by the time that happens, you have 1.5 million cumulative deaths in the long run. And you might argue, where did all these dire predictions come from? They're basically an implication of the basic reproduction number. Once you measure that to be, say, around 3, then this is pretty much what's going to come out of your epidemiological model for those two features of the model prediction. Now, fortunately, nothing like this happened in terms of the first peak of deaths. We're off by an order of magnitude, and that's true not just in the US, but pretty much everywhere in the world. So if we alter the model, I had a recent, Jim's worked on this and others have worked on this, but if I alter the model to just include a reduced form behavioral response where people reduce their activity, people in governments reduce activity in response to the level of daily deaths, then I can get the model to come very close to the data. The model now is in blue over the course of the last year. This discrepancy is, I'm going to argue, is the success of vaccines. And this is the new variant coming into the US. If we didn't have vaccines, we'd be having another peak right now. But what I want you to see in this picture is that just simply adding this behavioral response to the model, you get the model to cut off that first peak of daily deaths. And so it's not 30,000, but it's in the neighborhood of 3,000. It looks like what we actually experienced. But when you look at the cumulative outcome, it's still pretty bad. If we didn't come up with vaccines, this model would say we'd have 1.25 million cumulative deaths. Now, that's 250,000 or 230,000 less than what the previous simulation showed. And that's due to what's called behavior limiting over what they call overshooting of herd immunity. But we're going to see then that this long run outcome is then pretty much a limit to what we can achieve with further mitigation absent vaccines or a cure. And basically, why is it that the short run impact of behavior is so powerful in reducing the first peak, but then doesn't have much impact on the long, as nearly as large an impact on the long run outcome? And that's basically because if behavior is responding to the level of the disease, what it does to the equilibrium outcome is at first when we were in that initial phase and deaths are growing at say 30% a day early on in New York, behavior starts adjusting very rapidly, and it kind of slams the brakes on the epidemic very quickly. But then once you reach a certain level, it acts kind of like a cruise control on a car. As prevalence rises, you slow down. As prevalence, as deaths fall, you speed back up again. And so you keep the growth rate of deaths pretty close to zero, or that keeps the level of deaths kind of wandering around. And you go, how long does this go on? Well, it can't stop unless there's a force other than behavior to bring the epidemic to an end. Why is that? Well, behavior is going to go back to pre-pandemic norms if the disease starts to fall too low. And of course, if behavior goes back to pre-pandemic norms, then if there's any disease around, it just comes right back or the population would have to have achieved herd immunity either through infections or vaccines. So it means that you just drag the epidemic out for a long time until it ends at the standard notion of herd immunity that we've been talking about, for over a year. Okay, so now let's think about how does that constrain what we could have achieved, say, with, some federally organized policy for testing and tracing, or other, federally organized policies aimed at mitigation that would be looking to, do more to limit transmission and the speed with which this epidemic has progressed. So I now simulate the model with a scenario where, on top of the endogenous response of private and public behavior, state and local government behavior, we have some federal program that succeeds in reducing transmission by 35%, holding behavior fixed. And we assume that this federal program is maintained for 2 years. I just simulated it from May 2020 to May 2022. And you can see that you save a lot of lives in the first year. And this is a new variant coming in, but you end up pushing the deaths back into later years, and you run out the long run cumulative total of deaths, and we end up with the same 1.27 million that we had absent this imagined federal intervention. So I take that as being very discouraging news about, what we can achieve if you just have non-pharmaceutical interventions alone, and you're not willing to implement them essentially on a permanent basis. Okay, so then if one is going to have this discouraging perspective on, what can be achieved with further MPIs, one might ask, well, then what's the point? Why did we do all these lockdowns? Why are we doing this? And what I want to say is, and I think what we should emphasize more clearly when we talk about these things, it's the combination of the non-pharmaceutical interventions to delay deaths together with success in developing vaccines, or if it were a different pandemic, a cure, that's how you save lives. And that's really the point of doing these types of interventions. So in this simulation of the model, this third one, I just introduce a vaccination program on January 1st, where we vaccinate people in the population at a daily rate that's sufficient to, cover half the population by June 30th, and you keep the vaccination program going. And we see here, the first year looks the same, and the vaccination program, pretty much brings the epidemic to an end by late this year. This blip here is in the model, we have this UK variant. That's the UK variant speeding up, and then vaccines in this nice scenario, succeed. And we see that the long run implication for deaths is 672,000 here. So that is basically cutting the vaccines has succeeded in cutting the long-term death toll in half. And you go, that's great. But I want to argue we could have done better. If you had combined that, hypothetical or counterfactual federal program of extra mitigation starting in May 2020, carrying it through 2 years with success in vaccines, then you get this second wave coming from the UK variant. But now the cumulative deaths are down to 292,000. So you can, by combining the two policies of intensive mitigation early on, and then of course rapid vaccine development, you can really bring the death toll down. And that, as I say, going forward, I think this is something that we should emphasize, and we should learn on how to communicate that effectively, when we come to the next pandemic. I think also, it's imperative in terms of policy that we look at, there's a bunch of countries that have been quite successful in following essentially this policy. This is a list of countries that are, had very low death tolls to date from COVID. And they have the prospect of being able to implement vaccination programs that'll mean they'll come out of this epidemic with much lower death tolls than have been seen many other places. And some people might argue that, we can't copy these countries for this reason or that reason. Down at the bottom, this is a list, this is a couple of universities in the US that have had tremendous success in controlling COVID on campus with very intensive testing, tracing, and isolation programs. So, we have real world examples that we should be studying for how we could do this non-pharmaceutical mitigation or interventions while waiting for vaccines next time we have a pandemic like this one. Now, I want to finish with one more simulation, which I regard as kind of the scary scenario of, why we should be paying attention to learning what we can about these interventions now and, not waiting. And that is, we're not entirely sure that immunity gained through infection or even these vaccines is going to be long lasting. The virus is mutating, and then just the human immune system might lose immunity anyway. So I did one final simulation of the model where I have the behavior and I have there's seasonality and transmission in all of these simulations, but I have that immunity only lasts on average for 18 months. I maintain the vaccination program at the current rate of, you do about half the population every 6 months. I've run that for 5 years. So imagine that we're continuously vaccinating the population, but we're losing, because on average, after 18 months, people go back to being susceptible to the disease. And under that scenario, then COVID becomes a seasonal disease that kills about 100,000 Americans a year, just year after year. And it's this scenario that I want to say that should motivate us to think about we should be equipping ourselves with better testing, tracing, mitigation programs that have lower economic cost, and we should be focused on that, basically as soon as possible. So with that, I'll end, and I'll turn it over to Abigail and Christy to talk about the economic side of the situation.
Okay, thanks. And of course, that could just also be because of evolving variants.
Yes.
Too. Okay, so Christy, you're up. Macro.
Just a sec. Excellent. Well, thank you. It's a pleasure to be on this panel. As Jim suggested, I'm going to be talking about the macro fiscal policy side of the pandemic after 1 year. The starting point is obviously that the United States and other countries have taken just extraordinary fiscal actions to respond to the pandemic. So including the most recent 1.9 trillion American Rescue Plan, the US has allocated more than $5 trillion to respond to the pandemic. And so as we enter the second year, it seems like a good time to assess those extraordinary actions. And I really have three questions that I want to look at. One, just what do we know about the variation in the fiscal expansion across countries during the pandemic? Second, sort of focusing in on the US, were the fiscal actions taken appropriate for the unique conditions of a pandemic recession? And then finally, are the fiscal actions likely to have long-run consequences? All right, so let me start with the variation in the size of the fiscal response across countries. So David Romer and I have tried to put together some consistent data on the size of deliberate fiscal packages early in the pandemic in OECD countries. So we only go through July of 2020 in part to try to minimize the feedback effects from local conditions. But we also are trying very hard to only include things that affect the net budget deficit. So not tax deferrals or loans or liquidity measures. All right, so this is what comes out of our analysis for the size of the size distribution of the early pandemic packages. And these are as a share of GDP. And you can see even within a sample of advanced countries, the OECD countries, you see a lot of variation. So some countries did very little. We see Mexico, Hungary, Belgium there on the low side. And some countries did a lot.
Christy, if I could interrupt, I believe you think you're sharing your slides perhaps, but you're not.
Oh my goodness. Yes, I'm so sorry. Thank you. Let me just see what, I'm not sure.
We can all try to visualize that plot.
No, let's try this again. How are we doing now?
Yep, good.
Excellent.
Great.
I'm so sorry. So here's what you were trying to visualize in your mind. And so as I was saying, you see the United States over there, tied with New Zealand for the largest. Something that really strikes me from this as someone who was there back in the Great Recession trying to get fiscal packages is just how much bigger the response has been to the pandemic. So in this sample of countries, the average pandemic fiscal package was about 5% of GDP. For the same sample, the early Great Recession package was about 1.5% of GDP. Now, in previous work on the fiscal response to financial crises, David and I looked at the role that fiscal space played. And we found that countries that began a crisis with a lower debt to GDP ratio undertook much more expansionary fiscal policy. So I've tried to look at and see if that pattern continued in the pandemic. So this picture just shows a scatter plot of early fiscal packages on the vertical and the debt to GDP ratio at the end of 2019, so before the pandemic began. And I think it's fair to say it's pretty hard to see much of a relationship at all. I have highlighted sort of the big countries of the Eurozone in red here. And you do see for that small sample, the kind of expected negative relationship. Germany with a low debt to GDP ratio did a lot. Italy and Greece with a high debt to GDP ratio didn't do much. But you see there are just tons of exceptions to that pattern when you think about the broader sample. And regressions confirm what your eyes tell you, that there isn't really much of a relationship here at all. And indeed, this lack of a relationship is remarkably robust to every kind of permutation you might think in the regression framework. So for whatever reason, fiscal space seems to have mattered relatively little in the fiscal response to the pandemic. Okay, so that's the variation across countries. Let me turn now to assessing the US fiscal response to the pandemic. And I think a really important first step in this assessment is to point out what I see as sort of crucial differences between a pandemic recession and an ordinary recession. So one difference involves the goals of policy. So I think the evidence has shown that a fall in demand is a key forcing variable in both types of recession. But importantly, in an ordinary recession, the goal of policymakers is just to get demand back up as quickly as possible. But in a pandemic recession, one has to factor in the crucial reality that the virus thrives on human interaction and hence on economic activity. And as a result, policy should only stimulate as much output and employment as can be done safely. A corollary to this is that the public health situation is really everything, right? The state of the virus both determines what can be produced safely and ultimately, I think, how much people actually want to spend. Right? A second difference is that the effects of a recession are particularly unequal in a pandemic. So we know that the effects of recessions are always unequal. Some workers and some sectors are more affected than others. But the effects of a pandemic recession, I think, are uniquely unequal. So some workers can easily move to remote work and may even benefit from increased flexibility, the end of long commutes. But other workers may be locked out of their jobs for long periods by shutdown orders. And essential frontline workers may be forced to take additional risks to their health and safety. Right? And then a third important difference is that aggregate demand stimulus in a pandemic recession doesn't flow to the most affected. So in an ordinary recession, it isn't essential to focus aid closely on the most affected because stimulus in one area will flow to other sectors as workers earn more and spend throughout the economy. But a pandemic short circuits this process. So no amount of broad stimulus will put waiters and hairdressers back to work if their sectors are shut down or people are afraid to go out. Right, so these unique features of a pandemic recession, I think, have two important implications. So one is that pandemic fiscal policy needs to be directed much more towards social insurance or direct relief, if you want, than toward a general stimulus. Right? The goal is to provide people with the income they would have received if they had fought to insure themselves against pandemic unemployment. Now, of course, to the degree that there's a general shortfall in demand, some general stimulus is likely to be appropriate, but it's targeted aid that's really essential. And second, just keep coming back to the idea that dealing with the root cause of the recession, in this case, the virus, is just simply essential to recovery. All right, so with these general principles in mind, let me turn to the particular fiscal measures that the US took in response to the pandemic. So this table just shows you the rough breakdown of how we allocated that $5.2 trillion. And you can see there's lots of acts. So I think so let's kind of, I like to put them into some categories. So in terms of sort of how appropriate they were to the unique conditions of the pandemic. So in my valuable and effective category, I think the most obvious one is the public health spending. We did about $600 billion of that. It was, as Andy's paper points out, it was essential to contain the terrible toll of the virus in terms of illness and death, but it was also essential for the economy. Dealing with the root cause of the recession was and still is crucial. And I'd say, indeed, given the continuing infections and the economic consequences, it's pretty clear we should have spent more on things like testing and vaccine distribution and genetic sequencing. I'd put the enhanced unemployment benefits again in that highly appropriate and effective category. This is exactly the type of targeted relief that's called for by a pandemic recession. It gets the aid to those most directly affected, and so helps to deal with that extreme inequality that results from a pandemic recession. And to the degree that we need general stimulus, it provides it. The benefits are largely spent and actually spent on things that are relatively safe to produce, like rent and food and things like that. I'd also put the state and local fiscal relief into this highly valuable category. You know, the pandemic recession has not been nearly as catastrophic for state revenues as was previously feared, but certainly state and local spending has had to increase substantially to deal with the pandemic. And the federal grants to state governments, I think, has helped to continue needed services and deal with the public health issues. And so are another type of aid that's very much targeted to those most affected. All right, so what goes on the other side of the ledger, the not well suited to the unique challenges of a pandemic recession? I'd actually put the two of the highest profile parts of the various packages. The first is the one time, or I guess I should say the 3-time now stimulus payments to households. So these were certainly very popular And no doubt they helped some families weather the pandemic, but they were obviously very poorly targeted. They went to everyone under a relatively high income threshold. They also suffer from the problem that general stimulus just isn't very useful in reaching the people who are suffering the most, say because their industries are shut down. And there's also some evidence that the payments were largely saved and so provided relatively little immediate stimulus. The other program that I put in my less good category is the Paycheck Protection Program. So this, as we all know, provided what turned out to essentially be grants to small businesses if they maintained their payrolls. And there is some evidence that employment fell less in firms that were eligible for this program than in firms that were not. But the effects were so small that the implied cost per job was just saved was just ridiculously high. I think as much as $350,000 per job. Or to put that into context, estimates of the cost per job saved of the state fiscal relief back in the 2009 Recovery Act was about $30,000 per job. So I'd say that the PPP was a lot of money for what appears to be not much gain. So the bottom line of the analysis of the various pieces is that there was much that was great in the $5 trillion that the US spent on pandemic fiscal packages, but also a fair amount of misguided or wasteful actions. The last thing I want to talk about just briefly are some of the longer run consequences of these extraordinary actions, fiscal actions. So the first is related to some of the current discussion of whether the US economy is about to go into a rip-roaring boom because of the American Rescue Plan. The first thing to say, and I want to keep emphasizing this, is it all depends on the virus. If the virus continues to moderate, I think the economy will be poised for rapid growth. If the virus surges again, the economy will slow down or stall. And to the degree that the most recent fiscal measures have helped to speed up vaccinations and other public health measures, it could be very helpful to the recovery. Second, in terms of the coming aggregate demand increases, I suspect that the fiscal stimulus of the American Rescue Plan is actually just the tip of the iceberg. So I think we're all aware that personal saving has been very high throughout the pandemic, in part because people have just been unable to get out and spend. Between that and the boom in the stock market, households and nonprofits are sitting on about $10 trillion more of financial assets than they were before the pandemic began. So that's a lot of accumulated saving that could come pouring out when people feel it's safe to start spending again. And actually my former student, Jillian Brunette, has suggested that maybe the closest parallel to the current situation may actually be World War II, where forced saving during the war unleashed a spending boom afterward. But before we start panicking over excessive growth and inflation, I think it's useful to remember just that the labor market is still quite depressed. I find this picture a very important reality check. So payroll employment, which obviously fell just catastrophically last spring, has come back a lot. But importantly, we're still down about 10 million jobs from where we were before the pandemic began. And to put that into context, that's the size of the entire drop in payroll employment during the Great Recession. So we need a period of very rapid growth to heal the labor market. And even if we're lucky enough to get that growth, I think we're unlikely to push up against capacity constraints for quite a while. So I put myself in the camp of people that are not particularly worried about inflation. What I am somewhat less sanguine about is a second longer run consequence, which involves the decrease in our fiscal room to maneuver, right? And this picture just shows you what's happened to the US debt to GDP ratio, including the most recent package. And what you can see is that the debt ratio has jumped from about 79% of GDP at the end of 2019 to a projection of about 110% of GDP in 2023, which is going to be very close to the World War II record. Now, I described earlier that fiscal space seems to be much less important as a driving force for the size of the fiscal response to the pandemic than was true in the financial crisis. But we just don't know what's going to be true going forward. And I worry that that previous relationship could reemerge as the terror of the pandemic fades. And if it does, I think that the administration is likely to face growing resistance to additional spending precisely because of the run-up of government debt. And to me, this possibility kind of puts the misguided or the wasteful pieces of the US fiscal response to the pandemic in a somewhat harsher light. If spending $1 trillion on those one-time stimulus payments end up preventing spending $1 trillion on mitigating climate change, I'm afraid we will have made perhaps a very bad bargain. All right, well, thank you. Let me stop there.
Okay, thanks. That was great. Abby Wozniak on social insurance programs.
Absolutely. Thank you, Jim and Jan, for inviting us to be part of this really interesting panel. And I want to highlight that I think at this point, we're going to be able to drill down a little bit beyond the programs that Christy really helpfully outlined and talk a bit more in specifics about programmatically how did the efforts to support workers and families during the pandemic recession function and fare? And we're also going to make some suggestions for what we think policymakers should be considering in 2021. I want to highlight this is a joint work with Krista Rufini, who's also a visiting scholar at the Opportunity and Inclusive Growth Institute. And as such, the Fed disclaimer at the bottom of that first slide really applies to both of us. So like Christy, we actually group the programs that we're considering into two buckets. We are taking kind of a broad view of programs that reached workers, households, or families. Of course, all of the efforts in 2020 really fall on some continuum in terms of their connection to those parties, but we think these are the most important in terms of directly reaching workers, households, and families. And we group them into first a bucket that really had as its intention to stabilize the employment relationships that existed at the eve of the pandemic. And so we think of the unemployment insurance expansions and the new Pandemic Unemployment Assistance or PUA program that was built up as being a piece of that, since unemployment insurance is often intended in part to keep folks in the labor force. And we also think of the Paycheck Protection Program as falling under this bucket as well, because it had such a primary goal of preserving the employment relationships that existed as the pandemic descended. The second bucket of programs that we consider were designed to more directly support household balance sheets. And I think to some extent, this reflects our view that in addition to providing some stimulus, the goal of some of these programs was income replacement, but in a way that was doing so somewhat independent of the relationship to the labor market that might have existed prior to the pandemic. So for example, we put the economic impact payments in this bucket. We also put expansions to SNAP or the food security programs into this heading as well. And one program that we highlight as an important part of the response in 2020 that we think hasn't gotten as much discussion is the eviction moratoria or moratorium, if you want to consider the federal program that started in the latter part of 2020. This really doesn't get as much conversation because, at least until recently, it was not part of the big spending packages, but it could be a really important piece of stabilizing that bottom line for affected families. And so we think it's important to include it. So there's a lot of detail on how these programs functioned in the paper, and I'm not going to be able to go into detail on that today. Instead, I'm going to focus on really what we see as the main success that runs through in a common way through all of these programs, and then talk about the shortcomings that we saw, as well as hopefully getting to what we think the important considerations in the near-term horizon really are for modifying and expanding these programs and considering new ones. So the main success that we see is really that all of these programs, in our sense, were very successful at reaching the beneficiaries that they intended to reach, either through existing payment infrastructures or by expanding the existing payment infrastructures that we have. So we can think of this as kind of in a programmatic or a kind of plumbing analogy type way. The pipes worked, they got a tremendous amount of money out, and they went all the way to the end to kind of whoever would be touched by this program. By and large, we think most of these programs were very successful in reaching the folks that they were aiming to reach. I'm going to come back to the second point of did they reach everybody that was needed assistance when we come back to the shortcomings. We have many examples of how each program this applies to in the paper. I want to highlight one of them, which is the UI expansions. So what we're showing here is something that DOL officially calls the recipiency rate. It might more adequately be called a ratio. It's a ratio of continuing claims, usually on the regular UI programs, to an estimate of the unemployed population from CPS data. And so there are a lot of reasons why this may or may not kind of completely reflect receipt of UI benefits among folks who in the CPS say they're unemployed. But you can see from the graph that whatever this reflects, which we think is an adequate measure of UI receipt in some gross way, this changed dramatically in 2020. Going back quite far, recipiency rates tend to be below 50%. They actually ticked down after the Great Recession and did not really recover. But now in 2020, we reached recipiency ratios that sometimes exceeded 100%. You can also see in the adjusted line that we've graphed with the dashes that when you factor in presence on the extended benefits portion of UI, that rate remains very, very high. The reason it's coming down in the kind of more official number is that as folks move on to extended benefits, they move out of that numerator. But overall, the ratio of folks currently receiving some benefits to the population estimated to be unemployed in the CPS is extremely high. This is just an example of what we meant by the dollars went through the pipes and they reached the folks who are connected with these programs. Now, a shortcoming is that many of these programs missed the most marginalized. And we think it's important to make this distinction here. This is different from failing to reach intended beneficiaries. It's rather the case that there are a number of populations who, and I think this just reflects a failure of, many of our own imaginations to understand that there are many folks who are not simply going to be reached by these programs at all. And so as a result of using mechanisms where these folks were not connected prior to the pandemic in any way, the programs that we use to push out aid, even though it was a large volume of aid, we're going to miss these individuals. And again, we have a lot of examples of how this was a thread that kind of wove through many of the programs. One way to see that is to look at statistics that we've been monitoring from the Census Household Pulse Survey. I view these statistics as really indicating the consequences of missing these marginalized folks rather than as a true footprint of that. But what we see in each of these graphs is that, to generalize, food and housing insecurity have really been persistent throughout the recovery. And if anything, they seem to be worsening as the recovery goes on. I'm not going to detail the survey redesign in the Household Pulse Survey that happened in food insecurity, but what you can see is that over the course of the pandemic, these rates are fairly elevated. These are the share of individuals saying they can't afford to buy all of the food that they want or need. And what you see more importantly is that this has been trending up over the course of the pandemic. There's a lot of discussion about what, in terms of pre-pandemic data, to compare this to. Overall, regardless of how you do that, these levels are elevated. But for us, the big story is that in spite of huge volumes of aid going out, this situation is just worsening for some fraction of American households. And we take these data seriously as reflecting that. The housing security is in a little bit of a similar picture. We view the shed data point that we have on the left there as a more expansive definition of housing insecurity. So if you look in the census data, that's the pandemic era data, you see that this is a more strict definition that has levels about as high as the more generous shed definition. And again, these are trending up a bit towards particularly the last several months of 2020. This again gives us some concern that housing insecurity is worse for a fraction of the population than it was prior to the pandemic. And in spite of all the aid that's going out, it's not reaching the folks who are most affected by this, and it is trending up over the course of the recovery. Another way to see that the programs didn't reach folks that they weren't designed to reach is to look at the share of folks who had income loss. That's the blue bars in this graph. And this is the most recent data from the Census Household Pulse Survey. So as of February, the share of folks who had some income loss in the pandemic as compared to those who report having received some UI benefits in the course of the pandemic. Now, of course, I think there's probably reason to be concerned that that yellow line and the blue bars is not necessarily completely reflective of who exactly got UI benefits. This can be hard to harmonize in self-reported data. But I think a picture is clear here that there was significant income loss that happened in the pandemic that was not connected to the UI program. And this goes back to what were the EIPs doing? To some extent, they were making up some of this income loss. But nevertheless, that kind of insurance component that we were thinking about functioning and that Christy mentioned as part of the UI response was really not present for a significant share of folks losing income. And that's in part because the short-time compensation programs that were available were just so limited and used very modestly in this pandemic. So a second shortcoming is that targeting capabilities that were there went unused. So early in the response, limited targeting was indeed, I think, discussed as a real feature of the response, rather than spending the time and creating the barriers, frankly, to target aid to where it was very most needed, say in April. We pushed out lots of aid in a very broad way to kind of get the aid out speedily. But as the recovery progressed, we really only modestly incorporated other targeting capabilities that really were already there in much of the policy landscape. Just one example of this is that early on, the sectoral nature of the employment loss was very clear. But later aid could have targeted by industry of 2019 employment. We believe that's possible with the data sources that are out there. This just was not done. There's a small example of this in PPP with somewhat more generous benefits for restaurant and hospitality sector firms. But by and large, that capability to target by sector, even though it still would have been imperfect, was not used. We also believe that there are data sources on the marginalized populations that were most affected that could have been used to reach them as well. For example, the Medicaid rolls, and we discussed that in the paper. So I want to just conclude quickly and try to give us some time back for questions. The next thing we go to in the paper is to think about what the conversations should be right now about two things. One, how to phase out this historic level of support. So far, we don't think that's been a very large part of the conversation. Nevertheless, some of the recommendations that we make are reflected in the ARP. So we think that it makes sense to avoid massive cliffs and simultaneous benefit expirations, given that we've moved so much aid and support into the economy. An orderly revision or withdrawal seems to be in order, as opposed to kind of a uniform contraction of that. We have an order of retreat that we think makes sense, moving from programs that have, I think, the most direct hand in the economy and the potential for creating the most distortions, starting with the PPP, all the way back to things that we think are plausibly less distortionary, like the EIP and the SNAP payments. What we do want to highlight is that the eviction moratorium, again, is a real wild card here. Because of really limited pre-pandemic data, we just have so little information about who might even be benefiting from this right now. There's no data on who is actually being reached by this. We can make some inferences, I think, from some of the census data that we have, but it's just a really unknown piece of the landscape, and it could be a large part of the rental market. Regardless of the size, it's certainly very concentrated in some places more than others. And so thinking about how to roll that back and reach folks who might be using it right now, I think is a really important piece of the puzzle to consider in the next few months. So finally, what remains to be addressed in 2021? We identify in these first 3 bullet points things that we think are creating long-term impacts of the pandemic and that need continued attention to roll back their negative effects or mitigate their negative effects in ways that maybe haven't been received as much attention in terms of ongoing policy supports. So mental health effects, both addressing the persistent mental health needs that have happened in the pandemic, potentially through schools in a way to help families limit the spillover of mental health impacts to their children that we know from all sorts of research are present. Also thinking about those who might have experienced acute mental health impacts and potentially addressing those through a setting like the VA that has some experience in addressing that type of trauma. Learning loss, some ARP funds have been provided to address this already, but we think that given that fewer than half of American schools are currently operating at full capacity, it's unlikely that they're going to be able to stand up significant learning loss programs in the summer. So we need to be thinking about stemming learning loss as a kind of medium run project, at least into 2022 or 2023. And then thinking about how we are going to address potentially persistent health impacts for some folks of the COVID disease. In particular, how are we going to support and expand DI programs that might cover folks who are not able to return to full health after experiencing the disease? And then finally, a kind of longer term, medium term consideration is exactly what Andy is talking about. We need to be having programs that are going to support ongoing virus containment, think about ways to mitigate the effects of future outbreaks more quickly. And in our case, one thing we'll highlight is that bottom point, which is to shore up supports for those who need to test and isolate, particularly to understand whether employers are taking advantage and using the paid leave support that was designed to enable them to let workers stay home to evaluate symptoms that they might be experiencing. In an ongoing way, this will be important, always having folks be able to stay home, isolate, and test in any outbreak. And so I think evaluating how well that worked here and thinking where that needs to be shored up is important as well. Thanks so much, and I hope we have time for some questions.
Okay, that was just great. So we've got a few questions teed up already. So we're just going to start going to the floor. So the first is Bob Hall.
Traditionally the first, hey? Okay, so with respect to Andy's remarks, I think there's one more scenario that ought to be included, which is pretty profound, and that is the completely unnecessary delays in the propagation of vaccines. You know, there's 2 phases to testing a vaccine. There's the safety phase, and the safety phase is pretty straightforward and doesn't require a large sample. And of course, it can be done on an ongoing basis as well by monitoring people who've received a drug and taking full account, which of course the FDA does aggressively. Then, on the other hand, the efficacy phase, which is central to the FDA's procedures, is something that should be done on the basis of experience with the drug after it's being used, if it has, as vaccines do, a huge timing benefit. But although there were people screaming, jumping up and down, saying we're not doing things right, there's a very long delay. It's very important to remember in this respect that the molecule that was injected into me, the Moderna, in January, was created in February of 2020, right at the beginning of the knowledge of the problem. And there was no delay whatsoever in creating the vaccine. The delay was entirely in the testing process. So if we could really speed up the next vaccine or do the counterfactual of faster propagation, it would make a big difference in Andy's evaluation. Christy mentioned a question just briefly on the fly, but I think it's really important, and that's what is the prospect of expansion of the economy on the labor market side? with 6% current unemployment, we can't really realistically expect to push it down below 4%. So there's 2 percentage points of expansion there, but there's 3 percentage points lurking in the dramatic reduction in the size of the labor force, which is clearly related to the pandemic. And as the pandemic recedes, we're going to see a 2% increase in the participation rate, and that's equivalent to a 3 percentage point decline in unemployment. So actually, normally in expansion, there's no growth of the labor force, but we're almost certainly going to have a reversal of the 2% decline in the labor force participation rate that was clearly resulted from the pandemic.
Okay, thanks. So I'm going to remind or ask everybody to be really brief. We have a number of people who want to talk. Claudia Saab.
Hi, thank you. So this question is for Christy, though it addresses some things that Abby talked about too. So just briefly, so usually when we're in a massive demand shock, which I would argue we did see last spring, I mean, we had unemployment going up to about 20%. It's still around 10 if you take into account people who've left the labor market. So what I was taught by a lot of you all is that in a moment like that, you should be doing very stimulative fiscal policy, such as the stimulus checks. So as Abby was talking about, I mean, our safety net it doesn't reach a lot of unemployed workers. It was better with the policies that were put in place this time, but we still had, I mean, when she was showing replacement rates, that we were still missing 40% of unemployed workers, right? So people still have to pay their rent, they have to feed their kids. You know, given the safety net we have, why aren't sending checks out good? Because they do get to those people falling through the cracks. So thanks.
Thanks. Catherine Abraham.
Thank you. I just wanted to pick up on a comment that Abby made about the limited use of short-time compensation programs during the pandemic. It seems to me that that was really a lost opportunity for U.S. policy, that there are a lot of advantages to giving workers prorated unemployment benefits when their hours are reduced, as opposed to requiring that they be fully laid off before they're eligible for benefits. I think it helps workers avoid the costs of long-term unemployment. I think given that many of the businesses that were impacted are, we're going to need the same type of businesses in the future, it would help them. There is, of course, the issue that you worry about impeding needed reallocation by keeping people on their current jobs. But in this situation, I'm not very worried about that. So I'd be interested in both Abby and Christy's thoughts about whether, as we think about future policy, trying to find ways to make more use of short-time compensation in response to temporary downturns might be a good thing.
Maury Oaksfeld.
Just to comment on Andy's presentation, I think one becomes even a little bit more pessimistic if one reflects that variants are likely to be endogenous. They can arise even when a big percentage of the population is infected or immunized. And a cautionary tale is from Manaus in Brazil, where the Brazilian variant arose even though 65% of the population had been estimated to have been infected. So pockets of people can be important breeding grounds, and we have two of them at least to think of. First of all, the vaccine hesitant, and there are a lot of them, surveys show, and also developing countries. The Kaiser Family Foundation estimated in March that so far these countries have been able to purchase only enough doses to vaccinate 30% of their populations. So if that process takes a long time, we could be in for many more variants.
Steve Davis, brief.
Yes, thanks. Great panel. I wanted to make a comment about the pipes of the UI benefit system, to use Abby's metaphor. There's a report from the Inspector General of the Department of Labor last month, and they say two things that are relevant to this discussion. One, in 14 out of the last 17 years, the improper payment rate in the UI system has been 10% or more. And they also say their initial audit under the CARES Act suggests it's likely to be higher. Home gets much higher. So if we put that together with the numbers in Christie's table 1 about the size of UI benefits payments in 2020, that's what I think it was, we may have misdirected, and that includes fraud, something on the order of $100 billion through the UI system. And that would take $100 billion from the first part of Christie's appropriate spending and put it in the inappropriate spending category. And I emphasize that as just, there's a huge problem in the functioning of the UI system. And that's not the whole of it, but that's a big piece of it. It undermines the targeting goal of that program. And it arguably involves a large waste of funds, even by macroeconomic standards.
Okay, I'm afraid I'm just going to have to call it there. There's a bunch of interesting questions, both in the Q&A and I'm sure on tap, but we've got to keep going. I would urge people to make sure, people who have questions and want to continue this conversation, join the lunch breakout session. Okay, so we're going to take a brief break, and then at 12:10 Eastern, we will reconvene for the next paper. Thank you.
Thanks for watching. Be sure to like and subscribe for more videos from Brookings.